Welcome to Module 8, which will focus on verification and validation of COVID-19 mitigation strategies. Here are the take-home messages and what I will briefly discuss today. FDA, CDC, and others globally have at this point laid out a very clear set of strategies that are important to minimize the risk of COVID-19 transmission in food processing plants. However, consistent implementation and documentation of these interventions and their implementations are key and are essential and can't be forgotten. For those of us that work in food safety, HACCP, Food Safety Modernization Act, and other food safety activity provides a clear framework for how to do consistent implementation and documentation. Key benefits of a formal system with documentation, verification, and validation will not only be improved control of COVID-19, but also reduced legal liability and risk, particularly if employees might accuse that they acquired COVID-19 in a facility. But for this, written documentation of procedures and verification will be essential, which is what we will cover today. In order to make this work, it is important that we understand that we need to focus on a risk-based system for controlling COVID-19. As a reminder, in our case, the hazard is SARS-CoV-2. If we were to have what I would consider a hazard-based system, we would focus and try to control every and anything where the hazard does occur or may have occurred. For example, surfaces. A risk-based system, on the other hand, focuses on those areas that have the highest likelihood or probability of causing harm. So risk-based system focuses on likelihood of acquiring COVID-19 in our case. And that's what we need to focus on with regard to implementation of control strategies as well as their verification and validation. Here, what I see as the key steps to verification and validation. And one way to think of this is a framework for COVID-19 preventive controls. For those of you that are familiar with the FDA preventive controls approach. First, you need to identify the control strategies that you want to and will implement. And as said before, they need to focus on the high-risk areas. You then need to determine how you will validate them, establish possible critical limits, monitor the controls, establish verification procedures, and maintain accurate record keeping. And over the rest of this presentation, I will just make this more tangible with practical examples. But just like HACCP and other food safety systems, before we focus on verification and validation of these control strategies, we need to have certain prerequisites in place. Think of these as prerequisite programs. One of them that I would suggest as a prerequisite is to have a COVID czar, a person that is responsible for management of COVID-19. This should be a subject matter expert that will take both inward and outward facing roles. Inward facing would include training, implementation, oversight of control strategies. Today in the US, this would also be the person that can answer questions about vaccination and will assure vaccination training. Outward facing roles would include relationships with health departments, OSHA, CDC, etc. Another prerequisite would be to develop and implement a foundational COVID-19 training program. This should focus on the basics of COVID-19, transmission, etc., and these days should probably include a strong focus on vaccination. And we should make sure we keep a training record to assure that we can prove that people were trained and know what they are supposed to do. So now once we have these prerequisites out of the way, we have to decide on control strategies. This is the current priority list of control strategies that we at Cornell recommend as of early June 2021. But this, of course, may change and may be different depending on which region you are. Key priority today is to get COVID-19 vaccinations, ideally have your whole workforce, everyone who is eligible and does not have religious or health reasons for not taking it, vaccinated. The second one is to practice social distancing and wear face coverings. And in the age of vaccination, this is obviously particularly important for those individuals that are not vaccinated. The lowest on the list, or too low on the list, is cleaning and disinfecting frequently touched surfaces. That used to be considered an important part of COVID-19 control strategies. We've really recognized now that contaminated surfaces are not a major route of transmission. Minimizing community spread is on the bottom of this list, but it's one of the ones that's probably a little bit more debated, how much of a responsibility this is for food companies, where this should fall in the priorities. So this is our recommendations, our consensus, but not necessarily what you should follow. But it gives you an idea of how to decide what to focus on. Once you've decided what to focus, you need to decide how you validate and verify these procedures, these control strategies. The way we define, or I define validation, is that you have data, scientific data, that the strategy you implement is effective at controlling COVID-19 transmission. Verification then is data that show improved consistent implementation of these interventions, of these validated interventions. Practical non-COVID example would be pasteurization. For example, pasteurization of milk. Our validation would be scientific data that show that 72 degrees centigrade for 15 seconds provides a more than 5 logs, or more than 100,000-fold reduction of vegetative pathogens of concern. These are scientific studies, and this is laid out in the pasteurized milk ordinance and regulations throughout the world. So in this case, we're very lucky that we have a very clear validation. Verification then is continuous recording of temperature and flow rate, if we're talking about high temperature, short time pasteurization, because flow rate and the length of a holding tube can be translated into time. Therefore, we can prove that every drop of milk or another beverage that leaves our facility was indeed heated to 72 degrees centigrade for 15 seconds. Now, how do we apply this to these control strategies for COVID-19? Vaccination is the first example. What will be validation? Similar, or at least in my mind, similar to pasteurization, the FDA approval and the data that show that vaccines are effective against SARS-CoV-2 infections, so symptomatic and severe disease, and reducing hospitalization, that's our validation. But we also need to realize that there are data that show that vaccinated individuals can still get infected and shed the virus. It's not perfect. Neither is pasteurization. There's always a residual risk. With that, many facilities will require mask use only for unvaccinated individuals. This is clearly a trend we see right now. So with that, the verification of the vaccination status is very important. You need to make sure that everyone who is not vaccinated wears a mask. You can only do this if you know who is vaccinated. This may not be as simple as it may seem, because you need to assure that confidentiality is protected, and I suggest that you work with legal counsel on this. You do not want to end up in a situation where you have a person that shows and proves that they were not vaccinated, cannot prove that they were vaccinated because they weren't. They wear masks, and then at some point they will be laid off, and then can claim that they were discriminated against for either religious status or for health reasons. So you have to be very careful how to do it, but it is very, very important that you have this verification strategies in place, also to protect the employees that you still have that may, for some reason, not be able to be vaccinated. Let's talk about validation, verification of social distancing and wearing face coverings, which increasingly less important, but we will continue to have unvaccinated individuals. So this will stay important. So validation, CDC and FDA guidance, critical limits, could be 6-foot distancing, could be the face mask, covers mouth and nose. Verification could be visual verification with a written record, could be at a prescribed frequency, 10-minute observation in the facility every 4 hours, every 2 hours, whatever. Could be technological solutions, could include data on mask performance. And then if these are not followed, you do corrective action, retraining and recording corrective actions. Here's an example of a sheet that could be used to manually verify face coverings and social distancing. And there are also technological solutions in place. But again, with vaccination, this becomes rapidly less important, particularly in those countries that are able to vaccinate a large proportion of their population and workforce. Excluding individuals that shed SARS-CoV-2 from work, this will continue to be important even with vaccination. As we said, there are clear reports that in some rare cases, even vaccinated individuals can still become infected. So it may make sense for you to continue to have some procedures in place that minimize the risk that someone comes into a facility that is shedding SARS-CoV-2, someone that is infected, including potentially vaccinated individuals. So critical limits could be no shedders admitted or no shedders in the facility. Verification can be challenging, but it could be a recorded records that indicate that all employees are screened. These days, again, with broad-based vaccination, this would most likely be self-reporting, however, where people still every day have to fill out a short 3 or 4 questions saying that they did not show fever, did not show COVID-19 symptoms, and a few others. This is still what, for example, Cornell does, even for vaccinated individuals. It's the 2 things we do at Cornell today is if you're vaccinated, all you have to do is fill out this self-questionnaire every morning before you go into work. Minimizing community spread, that could still be important, particularly if you have communities, for example, where vaccination coverage might be low for religious or other reasons. Key strategies there may be to do a multilingual, multimodal training, do training on vaccination if we can, and if appropriate, if not, at least work on making sure that people have training what they can do to minimize community spread. Again, this depends on the fact that you use, and minimizing community spread is one of your interventions that you deem important and relevant for your facility, wherever you are. A caveat for all of these things, if you want to assure consistent implementation, you need to make sure, you need to think about having a COVID-19 control culture, very similar and analogous to food safety culture. This is something we will cover in another module after this, but I just wanted to mention this because with all strategies that we talk in, this is an important part of the bigger picture. With that, we're back to our take-home messages. Hope I've provided you with some more details. I've given you some details how you can and should assure consistent implementation and documentation. If you get pushback, there will be pushback because with vaccination, I think in many cases, people expect to not have to do any of this anymore. And I'm still convinced that even today, even if you have a workforce that is by and large vaccinated, having documentation, having verification and validation in place is important, not just to minimize the potential for small outbreaks in a few cases, but also to reduce legal liability. Thank you very much.